Well, hello. Good afternoon, everyone. So today we'll be talking about transforming patient care and how we have implemented Uncork digital front door at Maimonides Medical Center. So let's get started. So a round of introductions. Rob, do you want to go first?
Good afternoon. I'm Rob Cimino. I'm the Vice President for Digital Health Strategy and Implementation at Maimonides Medical Center. If you're not familiar with Maimonides, we're the largest hospital in Brooklyn, just over 700 beds, 6,500 staff, and we serve as the tertiary services hub for many hospitals in Brooklyn.
Right. Yep, and I'm Suma Nittur. I'm working at Persistent Systems as a program manager. I'm working with the Intelligent Business Automation Unit, focusing on Uncork. So this is my first time I'm attending Uncork Create event. So as you, right? Yeah, so really excited to be here. So let's get started. So we're going to talk about how patient care is getting transformed. So if we look at over the past 2.5 years, due to the pandemic, a lot of things have, the industries, our way of life, that has been disrupted. And it has forced a lot of industries to adopt digital technologies at a faster pace. Right? Now we're focusing on healthcare industries, and if you look at the different trends that are upcoming, so the first one is personalized healthcare. So consumers or users or patients, they want to have access to their personal health records, their own data, and they also want to have insights from it. Okay? That's just the one of the most emerging trend that we have seen. Another one is hybrid care model, so wherein consumers or users, they want to have the convenience of getting healthcare either virtually or in person. So that's the other trend that we've seen. The third trend is about having analytics and AI embedded into your healthcare applications, which gives the flexibility of having data when you want it, wherever you want it, and at your own pace, right? And having the right data. And the last one is about having the personal health records in a secure way. So whatever transactions that you're having, those should be because it's extremely health sensitive data, so it has to be secure. Right. Now, if we talk about the healthcare industry itself, did you know, Rob, that there are about 30 billion transactions that are processed for healthcare, and the cost is about $250 billion. And all this cost is mainly because of repetitive manual tasks that keep happening, and this increases the operational cost, it hits your revenue margins, and also it has added cost to the patients. Right. So if we want to increase our revenue margins, if we want to have benefits to the customer, so what is the best way? So the easiest way that we can think of is having automation in an intelligent way, wherein all the repetitive manual tasks are automated. So what will happen with automation is that it becomes less error prone, right? And the healthcare staff, they are having more time to give more valuable service and more valuable care to the patients. Now, if you look at the different use cases that we have for intelligent automation, so we have different user areas over here. So we have claims, risk management, then we also have clinical trials. So these are different areas where you can have automation built in. Now, to talk about healthcare, now, if we want healthcare industry to adopt digital technology faster, and if we want to have a robust digital front door implementation, the first thing that you would think of is having a DFD. So what is DFD? So digital front door is nothing but a strategy that will increase patient engagement and patient retention, right? So Rob, you have that experience of implementing DFD, why don't you say?
So at our hospital, going back to 2019, we were just really starting this journey and trying to understand if we were going to build or buy technology for a digital front door, and made the decision to build it partially because of our history with health records and health technology. Maimonides was an early adopter of electronic records and pursued what's often described as a best-of-breed solution. So we had multiple health records specific to different settings, a separate billing system, separate scheduling system for the enterprise, and decided that we wanted to unify all that for our patients behind a single front door experience. And to do that, we felt we really had to build it ourselves.
And the advantage of having a digital front door, it not only gives you, there are different cost benefits that have been mentioned over here. So it increases patient retention, and it also has a huge value add not only for the healthcare providers, but for the patients as well. Now, I think we're going to talk about how it was implemented at Maimonides.
So this slide is just a little bit about how we define digital health at our institution. So my team sits outside of IT and outside of marketing, where responsibility for all of our legacy systems and our web reside. And we have two major areas of focus in digital health. One is what we call digital patient engagement. So that's a kind of fancy way of saying we need an app for our patients. And virtual care, which is all of the programs that we've implemented to deliver and enhance care through digital channels. So virtual consults, virtual visits, asynchronous consults, remote patient monitoring. Going back to what you were talking about earlier about adoption, in 2019, we had a plan that said we were going to experiment with all of those technologies. And in March of 2020, we decided to do all of them immediately in response to COVID. And we've done an amazing amount in a very short time. But at the same time, we're building the first iteration of our patient app, which we're going to show you in just a moment.
Sure. Right.
Because we didn't have a digital front door, we didn't have an easy way to connect patients to providers. So access is a huge issue, patient self-scheduling. We had offerings from many of our vendors to engage patients. So we could have introduced an interface to our scheduling system, a separate interface to our health record, a separate provider directory on our website, which we had in 2019. But that requires patients to access these things independently, and in many cases, establish user accounts. It didn't seem like a strategy that was consistent with where the needs of our patients were going. Right. The provider directory that we had at the time was very cumbersome to update. So provider directory is very often where patients will start, I have a problem, I need to see a doctor, how do I find that doctor and connect with them? And it was a very laborious process for us to update the web directory that we had at the time. And then finally, we needed analytics behind all of this. So as many of you probably know, you put an application out in the world, other than some comments that you might get back, the analytics is how you understand what's working, what's not, and how you drive process improvement. And so that was really important to us as well.
Right. Yeah, because I do remember at Maimonides, we have these different legacy applications, which on their own, they were fantastic. But when we wanted to have a single view across all the applications, that was a big challenge. We didn't have that. And that's precisely how we wanted to implement a digital front door as a strategy for MMC using Uncork as a platform. So we started off building up a provider and an appointment dashboard wherein the patients had the facility to self-schedule their appointments and also to book appointments with the providers and have a virtual session with them, right? Yeah, and that was implemented really quick. And at the front end, we have a very intuitive and a very interesting user interface, but at the back end, there are numerous applications which are getting integrated with in a seamless way. right, which really enhance the user journey.
As well as the administrative interfaces that we use to run all of it are all built in on Cork. And that's everything from how our marketing team logs in and updates provider profiles in real time to how our support team looks at where user accounts are and tries to address any issues that users might be having enrolling or accessing their account. And so, you know, when we went live, we had what you typically do. You have what you need to get the minimum viable product launched. But now as our enrollments have grown, we've gone back and revisited those and have a much more robust administrative interface that gives different parts of our organization access to the parts of the back end that they need.
Right. And we not only increase the reach of the application by having it available on a web application as well as a mobile application. And I think you're seeing more interaction on the mobile application, right? Yeah,
I mean, I think one of the benefits of Uncork is that we can develop for web and have it adapt to mobile web.
Mobile as well.
That's great.
Right.
We felt like we were in a bit of a turf war here in a competitive market in New York. All of our competitors have native apps, and we were able to work with Persistent and Uncork to figure out how to deploy that same experience as a native app for both iOS and Android.
And for Android, right. And can you talk about the outcomes? What are the benefits that you're seeing?
Yeah, I mean, yesterday was the 1-year anniversary of the launch of the app. So it's an interesting week to be reflecting on it. We're in such a very different place than we were a year ago. We now have administrators from around the hospital updating their providers' profiles themselves, publishing updates. We have analytics on everything that goes on in that app. And we kind of live and die by those.
Right.
Daily dashboards, weekly dashboards, executive reports. We use the BI connector in Uncork to port data over to Tableau where my team does their work. And then self-scheduling that we built as part of the app has been a huge success.
It's been a huge success, right.
Every practice that we put live on self-scheduling immediately has uptake from patients. About a third of our appointments are scheduled in the middle of the night or early in the morning when we're not answering the phones.
Right.
And about 20% of the patients who find self-scheduling are patients who are new to the hospital. So that's been a real benefit in terms of growth.
Right. So, and the main advantage is having real-time availability. For patients, I think that's a huge plus, wherein they can see the appointments with the providers real-time. It's not a back-end interface, it's a real-time interface.
Yeah, and they see provider availability as part of the search results, so they know if I go and reach for that provider, I'm going to get an appointment, 2 weeks from now. And that's something that we worked with Persistent and the scheduling application provider to develop.
Right. And we also have the patient portal wherein the patients can access their health records, and they have access to all the health reports, the data, right, and even pay for their bills. I think the features is
so we've integrated with scheduling, bill payment. There's an interface to our registration system to help us do identity matching. Most of the core legacy systems at the hospital are integrated to the application through Uncork.
Right. And that's...
these are just some screenshots. I say all the time, it's really hard to make an app that looks easy. Big buttons, uncrowded screens. This is the workflow for self-scheduling. I'll share with you that our enterprise scheduling vendor thought our interface was better than theirs when they first saw it. It's been really well received by our patients. We just started tracking Net Promoter Score for virtual visits separately from in-person visits and are very encouraged by what we're seeing.
The numbers are good. Yeah, it's really interesting to see. And happy anniversary for the application.
And all of this is built in Uncork.
Yeah, absolutely.
This is all the front end. And as I said, we have many back-end interfaces now that are role-based, and we can provision users for access to whatever features they need to be administering.
Any questions?
Yeah, so you mentioned a native app, your desire to produce a native app for a multitude of reasons. So what we're seeing there was that a native app that's not the responsive web UI from Uncork.
That happened to be the native app. You cannot tell the difference. If you navigate to, and we're not maintaining them separately. We're not developing for them separately. We're developing an Uncork, and we've deployed a containerized version of that for iOS and Android, but you cannot tell them apart. You can navigate to the application on a mobile browser, and it will look exactly like that.
Okay, that's what I was going to ask, is that how you kept the continuity between that experience.
Yeah, so we're able to develop in Uncork and take advantage of how it adapts. And the native apps that we've deployed are just containerized versions of the mobile browser version of Uncork.
Okay.
How did you go about determining that Uncork is the right solution for this digital front door?
So we looked at a number of platforms that we thought we could build on, and we're also actively shopping for an SI partner to work with on the project. Uncork was one of 3 platforms that responded to a pretty robust RFI that we put out. And in the end, we decided that we thought there were advantages to partnering with them and giving us the flexibility to, to have the control that we wanted over the experience, which was a concern with some other solutions that we looked at.
I mean, don't let me monopolize the mic. I will if given the opportunity. So it remains, Uncork remains sounds like your integration layer, kind of orchestration layer with, I'm sure, other systems, scheduling system, et cetera. Given that it's a SaaS offering, were your other systems also SaaS offerings or on-prem or a mix of both?
It's a mix. It's a mix. We have a data center at the hospital where some of our legacy systems are hosted, and then we have solutions that are in the cloud. And we're doing API interfaces. We have, I hate to say it, we have one app that's actually iframed into ours, which I'd love to do away with. We've had no issues, building interfaces. We're working now on an interface that's going to, a secure link to Uncork through AWS for something new that we're working on for an eForms initiative. But yeah, Uncork is the interface layer and the front end layer for the whole project.
Okay.
Yeah, I was just looking at that. I was just looking at this for a presentation this morning. 12 or 13, if you include. So some of the back-end infrastructure that we're using, Okta for account management, Verado, if you've ever heard of Verado, it's an identity matching product that we're using for identity matching, and LexisNexis that we're using for identity proofing. So we're integrated with all 3 of those as well. It's kind of the foundation.
Can you speak to maybe some of the team dynamics and challenges? We hear a theme here with a lot of people is that there's low code or no code architectures sometimes turn off your traditional full stack engineers. There's obviously API layers and things, and I'm sure you have other teams that kind of handle from one layer down, while there's is it just the UI team that's handling Uncork, or how has that adoption or team blend?
No, you should. If I say getting this wrong, you'll correct me. So we work with Persistent Systems as our systems integrator. We have a managed services team that focuses mostly on fixes and kind of management of the team, and then a dedicated dev team that includes Uncork developers as well as mobile developers, UI people, UX. We're really happy with the Uncork solution, but no code is not no engineering. Right? Somebody has to have an idea of how to connect these things and how to deliver an experience that will meet the needs of your users, whether that's our patients or my colleagues at the hospital. To me, it looks like a pretty standard team for an app development project like this. But we have the advantage of working with the tools that Uncork makes available kind of out of the box.
So the solution Uncork is pretty simple to use. I mean, and to even implement. I mean, the implementation was really quick because the requirements were so clear and was well defined. The implementation was really quick.
But during the initial adoption, did you face any challenge in terms of setting up the infrastructure with the connectivity?
No, we have 3 uncorked environments. We have a dev environment, a staging environment, and a production environment. It's pretty standard. I'll be honest with you, I'm not a programmer, so I see it all from kind of the management perspective, and it feels like lots of other engagements, maybe even a little bit smoother onboarding. I'll also say that we had a lot of support from Uncork for this project. They were very interested in what we were doing with their product.
But did you set up any private link, anything to connect from the Uncork to your data center or in your?
We didn't need private link initially. We're doing that now for a project we're working on to connect to our forms repository. We're gonna support online forms through the app, and we had to build that. But it doesn't really feel specific to the Uncork platform. It feels very expected.
All right. If there are no questions, thanks everyone.
Thank you for your time.
Thank you for your time. Thank you.